everyone, and welcome back to Medigap Show. I'm your host, Holly Cohen, licensed independent broker and founder of MedigapCares.org, where you can schedule a free Medicare consultation any time of year with either me or one of my trusted licensed agents on my team. So today we are going to go over the A, B, C, and G's and D's of Medicare, all the different letters. I'm going to explain some of the rules and regulations if you're turning 65 or if you're retiring and going on to Medicare Part B for the first time. This video is definitely for you. If you're already on Medicare and you just want sort of a refresher course, this video is for you. Stay till the end. There's some really important information throughout. Feel free to schedule your free Medicare consultation at medigapcares.org. You'll find the link in my description below, or always you can call in to our office 855-265-6334. So today we're going to cover how to apply for Medicare. We're then going to cover the Medicare enrollment periods, and then Medicare Parts A and B, and then also we're moving on to Medigap, also known as Medicare Supplement Plans. Then we're going to dive into Medicare Advantage, which is also known as Part C. Then we'll move over to Part D, which are the prescriptions. And then lastly, we'll discuss IRMA and what that means to some Americans on Medicare. For all of our educational workshops, we always have a question and answer session. So feel free after you've watched the video to comment below, ask questions, give us a call. We're here to help you understand Medicare from A to Z. So let's talk about how to apply for Medicare. You have three ways that you can apply. You can either go online and you can create an online account at ssa.gov. The second way that you can apply for Medicare is to call Social Security. Just make a phone appointment. You can call them regular business hours, Monday through Friday, to make an appointment. Their phone number is 800-772-1213. The third way to apply for Medicare is to go into your local office. You can call the office first, make sure they're open. The number you would call would still be that 1-800-772-1213. But I have heard from many clients across the country, especially if you are retiring over age 65, many times it's easier to go into the Social Security office to process your Part B if your Part A started prior and you're retiring after age 65. So just a little side note, the easiest way, however, to do any of this is still going online and creating an ssa.gov account. If you get confused on their website, you can also give them a call as long as it's regular business hours, and they will navigate you through it. Their number is listed here, 800-772-1213. So in order to apply for Medicare, you actually start with its cousin, Social Security. Now, let's go over some of the deadlines in relationship to Medicare. We're going to talk about the initial enrollment period, which is called your IEP. This begins 3 months before your 65th birth month and extends 3 months after for a total of 7 months. It allows enrollment in Medicare Part A and or Part B. That time frame is the enrollment period for the Part D prescription. The second very important period of time is the annual enrollment period, also called AEP, which is October 15th to December 7th of every year. This allows beneficiaries to make changes to either your Medicare Advantage plan, if you're on a Medicare Advantage plan, or to make changes to your Part D plan. Lastly, the Medicare Advantage open enrollment period, we also call MA OEP. This takes place every year, January 1st through March 31st of each year. It allows those with Medicare Advantage to return to original Medicare. So now let's talk about the basics of Medicare. Medicare Part A, Medicare Part B, Medicare Part C, which is also called Medicare Advantage, Medigap plans, which is also called Medicare Supplement, and then we'll move on to Part D, prescription plans. Let's talk about Part A, inpatient. This covers inpatient hospital services, skilled nursing facility care, and hospice care. It covers hospital services, home health services. Eligibility is age 65 and over and have worked and paid into Social Security and Medicare for at least 10 years. Or another reason is if you've been on Social Security disability income for 2 years, you also will be eligible for Medicare even if you're under 65. So now let's talk about Part B, medical outpatient. This would include doctor's visits, including your specialists, outpatient care, which covers a wide range of outpatient services, including laboratory tests, X-rays, durable medical equipment, for example, wheelchairs or oxygen, and also it covers outpatient surgeries and ambulance services. So now let's move over to Medigap Plan G, also called Medicare Supplement Plan G. A Medicare supplement plan that offers comprehensive coverage for beneficiaries seeking additional benefits beyond original Medicare. A Medigap Plan G pays the 20% coinsurance of Part A. From day one, if you're on a Medigap, also called Medicare Supplement Plan G, it pays 100% of anything under Part A because it pays the deductibles and it pays the coinsurance. It also pays the 20% Part B coinsurance. Original Medicare will pay the first 80% of both A and B, and a Plan G will pay the 20% coinsurance and all deductibles of Part A. It simply does not pay Medicare Part B deductible, which this year in 2024 equals $240. On Plan G, you're only responsible for the small annual Part B deductible, which equals $240 in 2024. Now we're discussing Medigap Plan N, which is a pretty popular choice these days. Medigap Plan N is almost a twin to Medigap Plan G. It pays all deductibles of Part A. It pays the Part A coinsurance, the 20%. It also pays the 20% coinsurance of Part B after original Medicare pays the first 80%. The only difference between these two letters, other than a Plan G being typically higher in monthly premium than a Plan N, a Medigap Plan N does not cover Part B excess charges, which are additional costs that some healthcare providers may charge above the Medicare approved amount. Beneficiaries would only be responsible for paying up to 15% of Part B excess charges on a Plan N. It is the difference between what Medicare pays that doctor or outpatient facility for the service and what the doctor wants to receive in payment. So, for example, if you go into an MRI center and that MRI center wants to charge $1,000 for an MRI, but let's say original Medicare will only pay that MRI center 80% of $800. So they won't pay 80% of the full $1,000 that outpatient facility would like them to. So then the patient would be responsible for up to 15% of that excess charge if you're on Plan N only. And always verify with the healthcare provider when you're scheduling an outpatient Part B service to ensure that they accept the Medicare approved amount If they don't, ask them what you would owe if you're on Plan N. Remember, they can only charge up to 15% of the amount that that provider wants to receive from the patient above and beyond what Medicare is willing to pay them for that service. And before you schedule the Part B service, if you're on a Medigap Plan N, simply ask them, do you accept Medicare approved amounts, or am I going to owe something on top of what Medicare is paying you for this service? Also, on a Medigap Plan N, a doctor can charge up to $20 for the copay at the doctor's office, which does happen many times. Or at an emergency room, if you're on a Plan N, it could be a $50 copay unless you're admitted to the hospital. Then you would not have any bills, because then it reverts over to a Part A service, because then you're admitted to the hospital. So let's talk about the Medigap deadlines. Medigap open enrollment period. It starts on the first day of the month that you turn 65 or older and enroll in Medicare Part B for the first time. This year's monthly premium for Medicare Part B for most Americans is $174.70. So once that Part B begins, you then have 6 months before and 5 months after that Part B effective date, which will guarantee you access to any Medigap plan, whether it's G or N or any of those letters, without medical underwriting. After the initial enrollment time of 11 months, you must go through medical underwriting in most states. It can be denied the Medigap plan or charged a higher premium by the insurer for the Medigap plan. So now let's touch upon Part C, also called Medicare Advantage. That's usually, when you watch commercials on television, that's usually what you will hear about, is Part C, Medicare Advantage. So let's go over what exactly that is. A Medicare Advantage plan, also called Part C, is a replacement of original Medicare, Part A and Part B. What I just covered in the previous slides, Part A and Part B, that would be replaced. So your government Medicare, traditional Medicare, is replaced by a Medicare Advantage Part C plan if you choose to go that path. Now, you keep original Medicare if you stay on the Medigap, Medicare Supplement path. If you head over to this Medicare Advantage Part C path, just understand it is a private insurance company replacing your original Medicare Part A and Part B. Some people, these plans work pretty well for, but if you've been watching this channel for a long time, you'll understand I'm not a huge fan of Medicare Advantage, but I do represent them. I do write them for those individuals that it may be best for. These are provided by private insurance companies approved by Medicare. They replace your Part A and Part B coverage, and they do include additional benefits like prescription drug coverage, which is your Part D. Many times the monthly premium is bundled inside of a Part C Medicare Advantage plan, and there is no additional monthly premium for that. A Medicare Advantage plan also offers a PPO or HMO network for healthcare services, so you must ensure that your providers are in network for full benefits of the plan. The Medicare Advantage plans may also include extra benefits such as dental, vision, hearing, and wellness programs. Also, as a side note, if you choose a Medigap plan, make sure you ask your agent or broker. Some of those Medigap plans also do give you a free vision hearing plan, and some do offer fitness benefits as well. A Part C or Medicare Advantage plan also caps the out-of-pocket costs, and this amount does seem to grow higher every single year. Medicare Part D is a prescription drug program provided by private insurance companies approved by Medicare. It helps beneficiaries pay for their prescription medications by reducing out-of-pocket drug costs. Part D plans are available as a standalone plan for those with original Medicare, Part A and Part B, or as I said previously, a part of a Medicare Advantage Part C plan. Let's talk about Part D here for a moment. You always want to work with someone or do it yourself on Medicare.gov. I have other videos that actually show you how to go onto Medicare.gov's drug tool finder and figure out what your prices are for your medications. But it is a function of putting in your prescriptions and choosing what pharmacy that you like to shop at the most, and it's based on your county. Every year, during annual enrollment period, October 15th through December 7th, you are allowed to make a change to your Part D plan for the following plan year. And I recommend that you do this. Our agency, we do it for you at no charge. We do it as your advocate. If you have a Medicare supplement plan through us, we will always help you with your Part D prescription plan year after year after year. It is vital that you check in with your agent or broker, or you can even call into Medicare during October 15th through December 7th to see if you're still on the right drug plan for the following year. So some beneficiaries might see this acronym, IRMA. What is IRMA? Is it a hurricane? No. IRMA, it kind of is. IRMA, or Income Related Monthly Adjustment Amount, is an additional premium charged to higher income Medicare beneficiaries for certain parts of Medicare. It applies to your Medicare Part B and Medicare Part D premiums. Again, based on your income. If you have a much higher income than an average American, you may be subject to an IRMA surcharge. I'm also going to include a link to the table for 2024 IRMA in the description of this video below. IRMA is based on the modified adjusted gross income of the reported on the beneficiary's tax return from the 2 years prior. Now, over the course of my career, I talk to people who retire, they don't know about IRMA, and maybe look back 2 years might mean they have a real high income. However, once they are retiring, that income goes down. So there is also a full appeals process for IRMA so that you can get back down to the regular premium for Medicare Part B, which is $174.70 this year of 2024. So higher income beneficiaries pay the standard premium amount plus an additional amount based on their income bracket. IRMA is recalculated each year, and beneficiaries' premiums may change depending on their income reported to the IRS. Those affected by IRMA can appeal if they experience certain life-changing events that reduce their income. Please note, IRMA applies only to Medicare Part B and Part D premiums. And again, only if you are a higher income Medicare beneficiary would this IRMA apply. As always, feel free to drop questions and comments in the comment box below. We are more than happy to answer all of your questions. You can give us a call directly. We're happy to talk to you. No obligation. Everything is always free for you. Our services are free. Every insurance agent is paid by the insurance company. And so our commissions are already pre-calculated in your monthly premium. There is no difference speaking to one agent versus another. It's just a matter of which agent do you like best. Today on Medigap Show. If you like the video, feel free to hit the like button. And if you're new to Medicare or retiring soon, or just want to stay updated of the latest news and Medicare information, be sure to subscribe to the channel. And as always, please be well.